Hello, my name's Amy Goodman, and I'm the co-director of the Autism Now Center. This is our 34th video in our Autism Now Answer series. The topic for today will be the Affordable Care Act. I'm here with my colleague, Julie Ward, to discuss the Affordable Care Act. So, Julie, what is the Affordable Care Act?
The ACA, or Obamacare as it's commonly known, is a major reform of the healthcare system. It ends discriminatory insurance practices, it expands access to healthcare through private health insurance marketplaces with generous cost subsidies. It allows states to expand Medicaid, with the federal government picking up most of the cost. It improves long-term services and supports, promotes prevention and wellness, and much, much more. It was signed into law in March of 2010. Some provisions took effect immediately, but many provisions are just now being implemented.
So, how does this Affordable Care Act help individuals with autism and other intellectual and developmental disabilities?
Banning pre-existing condition clauses and ending discrimination against people with health conditions are critically important. Insurance plans will no longer be able to charge more because you have a health condition. Insurance plans will not be able to deny you coverage or deny you needed health care services because of a pre-existing condition. Also, expanding Medicaid to adults up to 133% of poverty, which is about $15,000 for an individual and $31,000 for a family of four, is also very important. When the law was passed, all states were required to expand Medicaid, but the Supreme Court made it optional for states while upholding the other provisions of the law. Today, 27 states have expanded Medicaid. This will help people who may not have qualified for Medicaid because they did not have supplemental security income or SSI, or had too much income or had too many assets.
So, what happens if I choose not to buy any health insurance?
People who are uninsured and do not purchase health insurance will have to pay a penalty or a fine. There are a few exceptions, such as people who earn too little to have to pay taxes. In 2014, the penalty is $95 per person or 1% of your yearly household income, whichever is higher. The yearly household income, the penalty is calculated by looking at the amount above the tax filing threshold, which is about $10,000. The penalties do increase in the next couple of years, and they are capped. If you already have insurance through your employer or a federal program, you do not need to worry about the fines.
Okay, so when and where can I start buying this health insurance?
The next open enrollment period will be run from November 15th, 2014 until February 15th, 2015, unless you qualify for a special enrollment period. Some reasons why you might qualify for a special enrollment period are getting married, having a baby, or losing your current health coverage. The website, www.healthcare.gov, is an excellent resource. You can find what options are available in your state. If you live in a state that built their own health insurance exchanges, you can connect to their websites. If the federal government is running the exchange in your state, you can enroll from the website. If you need help picking out a health plan or understanding how the system works, you can search for navigators and assisters in your area. These people are funded to help people with their health insurance. It also provides very clear descriptions of the many provisions of the law. But if you'd rather call someone, there's a 24-hour toll-free number helpline to answer questions. The number is 1-800-318-2596.
Well, that's very helpful, Julie. So, is there financial help for people to purchase these insurance plans?
The ACA offers help in the form of premium tax credits and cost-sharing reductions. People with income up to 250% of poverty, which is about $29,000 for an individual and $59,000 for a family of four, are eligible for both if they purchase a silver plan. Cost-sharing reductions help the person spend less on copays, deductibles, and other cost sharing. Premium tax credits help people afford the premiums and can be taken in advance or at tax time. People with incomes up to 400% of poverty, which is $45,000 for an individual and about $94,000 for a family of 4, can use the tax credits. There is also a limit on out-of-pocket costs, the amount the person pays above what is covered by the plan. That will gradually increase with inflation. It's currently at $6,350 for an individual and $12,700 for a family plan. One important thing to note, though, about out-of-pocket costs is that the expenses involved in purchasing services outside of the plan's network of providers do not count towards the out-of-pocket cost limit. So it's important to look at each plan's network if you want to maintain your current healthcare provider. Similarly, drugs that are not on the plan's list of covered drugs, called formularies, do not count, so people should make sure their medications are covered. In looking at healthcare plans, it's very important to think about what health services you need. The plan with the cheapest premium and limited coverage may end up costing more than spending more money on premiums and getting better healthcare coverage.
Okay, so my next question is who is eligible to purchase these plans in the marketplace and receive these assistance?
People who are uninsured or those people whose employers offer them unaffordable coverage. Unaffordable coverage means that it costs more than about 9% of their income. People who have public coverage, such as Medicaid or Medicare, or employer-sponsored coverage, cannot receive the subsidies or tax credits.
Okay, so what are some of the health benefits for each type of plan?
Each plan is required to provide healthcare services in 10 broad categories, known as the essential health benefits. The 10 areas are doctor visits, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management, and pediatric services, including oral and vision care. The federal government did not tell states or insurance companies what specific healthcare services fall into these 10 categories, so it may vary from state to state and plan to plan.
And my last question is, what kind of resources would you recommend for people who need more information?
Well, I certainly hope that this video answers some basic questions about the Affordable Care Act. I know health insurance law is very complicated, so people may want more information. As I mentioned earlier, healthcare.gov is an excellent resource. The Kaiser Family Foundation has a lot of useful information, including a calculator that can be used to help people figure out if they qualify for financial assistance. The ARC has information on our website explaining many of the provisions of the law. And the National Disability Navigator Resource Collaborative has fact sheets on many different areas that could be helpful.
Well, thank you, Julie, for joining me today. This has been a brief overview of the ACA, and I hope it's been helpful, and I hope it helps you with your journey into autism. And just remember, the more you know, the more empowered you will be.